Hi everyone. Today in this video we are going to discuss about CKMB test. What is this CKMB? CK indicates creatine kinase and MB indicates it is a specific isoform that is present in the cardiac muscle. That's why CKMB acts as cardiac biomarker. Whenever CK levels are elevated within the body, it may indicate a skeletal muscle damage or cardiac damage. So in case of cardiac damage, the patient may have myocardial infarction with few of the symptoms such as chest pain, dizziness, sudden sweating, fatigue as well as difficulty in breathing. If any of these symptoms are observed in the patients along with elevation of CK levels, then the cardiac damage can be confirmed by CKMB test. This CKMB is specific to the cardiac muscle. So by estimation of CKMB, we can rule out any skeletal muscle damage and confirm cardiac damage. So today in this video, we are going to discuss about the CKMB test. What is the role of creatine kinase in muscle contraction? What are the different types of creatine kinase isoforms? What is CK index? And what are the normal values of CKMB as well as CK index? We will discuss in this video. So CK is the creatine kinase. This enzyme is also called with another name creatine phosphokinase, CPK. Otherwise, it can also be called with another name phosphocreatine kinase. So this is the structure of creatine and we can observe free amine group within the structure of creatine which is going to be phosphorylated. Now this creatine can be phosphorylated such that it produces phosphocreatine or creatine phosphate. And here we can observe a phosphate group is attached on the free amine group. This reaction is mediated by the enzyme creatine kinase and the same enzyme is also responsible for conversion of phosphocreatine into the creatine. That's why this enzyme is also called as phosphocreatine kinase or creatine phosphokinase. In this way, creatine kinase is responsible for this reversible reaction. Now, why CKMB is required as cardiac biomarker? Creatine kinase is one of the protein which is a dimer made up of two subunits. Among this, one of the subunit is M, and here M indicates it is muscle type, and another subunit is B, and B indicates it is brain type. So based on these subunits, we have three combinations of isoforms. One is MM, second one is BB, and third one is MB. In this way, creatine kinase exists as three isoforms. Now, one form of the creatine kinase is the CKBB, which is also called as CK1 form. This enzyme is more abundant in the brain along with other tissues such as lungs, prostate tissue, bladder, uterus, even thyroid glands. In all these, CK1 isoform is present. Similarly, second isoform is the CKMB, which is also called as CK2 isoform. This enzyme is more abundant within the heart. That's why CKMB is selective for cardiac muscle. And third one is the CKMM, which is also called as CK3 isoform, and this enzyme is mainly present in the skeletal muscle. So these are the three isoforms of the creatine kinase, where the CKMB is mainly present in the heart, but a small amount of CKMB is also present in the skeletal muscle. Similarly, a small amount of CKMM is also present within the heart. So we can observe these two enzymes within the heart as well as skeletal muscle. But because of more specificity and more abundancy, CKMB is more specific to the cardiac muscle, and the levels of CKMB which is detected within the blood are mainly related to the cardiac muscle damage. And the CKMB released from the skeletal muscle damage will have less interference with the assay because this assay is specific to the cardiac CKMB isoform. That's why CKMB test is not that much specific as troponin test, but still by estimation of CKMB we can detect the possible cardiac damage in the patients. Now let us see the role of CK in muscle contraction. Creatine kinase is one of the phosphorylating enzyme. This enzyme is responsible for phosphorylation of the creatine to produce creatine phosphate. This creatine phosphate acts as source of ATP, particularly under excessive muscle contraction such as exercise or stressful conditions. Creatine phosphate can act as source of ATP, and for that creatine kinase is required. Within the muscle, the contractile mechanism involves the actin as well as myosin filaments, and when calcium binds to the troponin complex, the contractile mechanism is initiated, and whatever the inorganic phosphate that binds to the myosin filaments is going to be released, which brings the binding of myosin to the myosin binding sites. And then ADP is also released such that actin filaments can slide and produce the muscle contraction. But this ADP should be replaced on the myosin filaments where the glucose acts as a source of energy, and this glucose can enter into the muscle such that it is going to be converted into ATP molecules by glycolysis. Then this ATP can bind to these myosin filaments, which brings the detachment of myosin filaments. At the same time, ATP is converted into ADP as well as inorganic phosphate. In this way, ATP is required for repeated cycles of muscle contraction, where it is converted into ADP as well as inorganic phosphate that binds to the myosin filaments. But under exercise conditions, the ATP that is obtained from the glucose is not sufficient for repeated muscle contraction. In such situations, mitochondria plays an important role, which converts the creatine into creatine phosphate. And this step is mediated by creatine kinase enzyme. Now this creatine phosphate acts as source of energy, which can convert the ADP into ATP. For this, again creatine kinase is required, which is bind to the myofibrils. Now ADP can be converted into ATP. At the same time, creatine phosphate is converted to creatine. In this way, ATP is generated under exercise as well as stressful conditions, where creatine phosphate acts as source of ATP. Now when there is a muscle damage, the creatine kinase may be released into the bloodstream, where it elevates the levels of CK within the blood. And when there is a cardiac damage, the specific CK MB levels are elevated. When CK MB test is required, just we have seen that total CK values are elevated in few of the conditions such as skeletal muscle damage or cardiac muscle damage. So total CK includes the three types of isoforms such as CKBB plus CKMB plus CKMM. So when their levels are elevated, it may indicate either cardiac or skeletal muscle damage. In such conditions, CKMB test is done in order to assess the cardiac damage. So when the CKMB levels are elevated, it indicates cardiac damage in the patients. And this test is also done in the patients who are having few of the symptoms such as severe chest pain, sudden sweating, and difficulty in breathing. If these symptoms are persisting along with elevation of total CK values, then CKMB test may be conducted in order to confirm cardiac damage in the patients. What are the normal values? So whenever chest pain is going to be developed due to any heart attack in the patients, within 4 to 6 hours, the CKMB levels are going to be elevated and they reach to the peak values within 12 to 24 hours. After 2 to 3 days, again these CKMB levels comes to the normal value. So after heart attack, there will be a positive result for CKMB test as CKMB levels are elevated within 4 to 6 hours and they reaches to the maximum within 12 to 24 hours. The CKMB normal values are variable from 0.0 to 3.6 nanogram per ml. Normally these levels are very low and they are not detected, but they can be within the range of 0.0 to 3.6 nanogram per ml. And we can also estimate the CKMB index, which is the ratio of CKMB levels to the total CK values multiplied with 100. And normally this CKMB index lies less than 2.5%. So whenever CKMB levels are greater than 3.6 nanogram per ml, otherwise CK index is greater than 2.5 to 3.0%, then it indicates a possible cardiac damage in the patient. So that's about the CK-MB test. CK-MB is the creatine kinase MB isoform which is more abundant in the heart. Even it is not that much specific as troponin test, but still CK-MB can indicate possible cardiac damage and any myocardial infarction in the patients. So if a patient is having any symptoms such as severe chest pain, sudden sweating, fatigue, dizziness, difficulty in breathing, in such patients, the CK-MB test may be done in order to assess any cardiac damage. Or whenever these total CK levels are elevated, it may indicate either cardiac or skeletal muscle damage. In order to assess the cardiac damage, the CK-MB test may be done, and when these CK-MB levels are elevated, it indicates possible cardiac damage and it can rule out skeletal muscle damage. Creatine kinase is present as 3 isoforms, CK-BB, CK-MB as well as CK-MM. Among these, CK-MB is more specific to the cardiac muscle, which is also present in a little quantity within the skeletal muscle. But the CK-MB assay is more specific to the isoform present in the cardiac muscle. So this test gives an indication of cardiac damage such as myocardial infarction. The normal CK-MB values lies less than 3.6 nanogram per ml and CK index is less than 2.5%. But when the CK-MB levels are elevated greater than 3.6 nanogram per ml or CK index is greater than 2.5 to 3%, in such situations, cardiac damage may be present in the patients. In this way, CK-MB acts as one of the good biomarker in order to assess myocardial infarction. So that's about this test. Hope you have enjoyed this video. If you like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thank you for watching this video.